Zone of opposition refers to the shape of the diaphragm in relation to the insertion of the lower six ribs to the top of the dome. If the zone of opposition is optimal, the diaphragm will have a more dome shape compared to the photo on the left where the diaphragm is more flat. The diaphragm shape is dependent on the position of the rib cage, either that be internally or externally rotated. Fascial connections to the diaphragm are also depicted on the image represented here. This is the deep frontal line. Myers illustrates that the line arises from the plantar tarsal bones and the toes and can go all the way up to the mandible. This line encompasses not only the diaphragm but the pelvic floor, iliopsoas complex, thoracolumbar junction, longus capitis, longus colli, and scalene muscles. Postural functions of the deep frontal line include lifting of the inner arch, stabilizing the legs and the hips, supporting the anterior lumbar spine, surrounding and shaping abdominal pelvic balloon, or in general, the zone of opposition and its function in relation to synchronized movement with the pelvic floor and the diaphragm. Stabilizing the chest during respiration, and also stabilizing the neck. This line provides stability while other lines perform functional movements. And this is included with subtle positional changes as well. Either way, we're looking at a whole connective system that, give or take, if movement occurs or increase of respiration occurs, as mentioned before, something has to give. So in this case, when respiratory demands are high, the decrease or loss of function for stability control is present.